Hello, everyone, and welcome to our webinar, Discovery to Care, Moving Pediatric Long COVID from Research into Action. I'm Megan Carmilani, and I'm the president of Long COVID Families, and I'm also a member of the NIH-funded Recover Pediatric Coordinating Committee. The Recover Initiative is a major research effort funded by the National Institute of Health to better understand the long-term effects of COVID, including how it impacts children. As this research unfolds, families are left asking a pressing question. When will it lead to real care? When will a parent be able to walk into a doctor's office, get a diagnosis that makes sense, and receive real treatment and help for their child? And how to help their child move forward. As this research unfolds, families, I already said that. Before we begin, I want to acknowledge this, that nothing we discuss today will be fast enough for families who are living this right now. Children are in pain, and they are missing schools, missing their friends, and missing out on the joy and stability of everyday life. Parents are exhausted, overwhelmed, and too often navigating this without the support that they need. I want to honor that reality and acknowledge how heavy this burden truly is. When families first started speaking out about long COVID in children back in 2020, they were often told that it was just anxiety or pandemic stress. The public narrative insisted that COVID didn't affect children, but families knew what they were seeing and they didn't stop. They shared their stories, they advocated for their kids, and they pushed for recognition. During that same time period, doctors began diagnosing MIS-C, undeniable evidence that COVID could, in fact, affect children in serious ways. Those early experiences helped bring attention to the need for pediatric research. Then in 2021, the NIH launched the Recover Initiative to study the long-term effects of COVID. And for the first time, children were included in a large-scale federal effort to understand how post-viral illness affects them. That was a step forward, but research is only the beginning. If we want science to lead to care, we need to understand how the process works and what it will take to get there. Families have done so much already, and we can't do it alone. We will need to continue to partner with researchers, clinicians, public health leaders, and institutions to carry this forward. But before we begin, we'd like to get a sense where everyone is coming from. So if you could take a moment to answer a poll that we'll have in the chat. And the question is, what do you feel is the biggest barrier to care for children with long COVID right now? Lack of provider awareness, stigma and dismissal of symptoms, lack of treatment options. It does seem, though, that lack of provider awareness is what most people are feeling is the biggest barrier to care right now. Thank you for answering that. During the webinar, feel free to drop any questions you may have in the Q&A box, and we'll have time at the end to answer as many as we can. Now, we're honored to be joined by somebody who is here, who is helping to bridge the gap between research and care. Dr. Rachel Gross, Director of Pediatric Research for the Recover Clinical Science Core and an Associate Professor of Pediatrics and Population Health at NYU Grossman School of Medicine. Dr. Gross has been closely involved in research that is shaping our understanding of pediatric long COVID and what it will take to turn that knowledge into real-world care. It's an honor to turn it over to her now so we can better understand where the science stands and what happens between research and medical care and what we'll need to do to get there next. Thank you for joining us, Rachel.
Thank you so much, Megan, for inviting me to participate in the session with you today. Good afternoon, everyone. Thank you so much for having me here to share our research that's being done to better understand long COVID in children and to really discuss how we can be moving this research closer to improving clinical care and really raising that awareness that was highlighted as one of the biggest barriers. So I wanted to start with words of families with children of different ages that are living with long COVID, because I know so many of you out there are sharing these experiences. So this is a quote from one mother of a teenager who shared, "My teenage daughter had COVID in December 2022, and months later, she is really struggling. She has been out of school for 6 weeks with debilitating fatigue, pain, and brain fog, none of which show any sign of letting up. All in all, COVID has been a devastatingly difficult journey for my family, and it's not one I wish on anyone." Another mother of a school-age child shared, For over 3 years, long COVID has derailed my family's life. My 11-year-old with long COVID has missed over a year of school due to long COVID-induced fatigue, brain fog, POTS, celiac, and PANS. And my own long COVID journey has made caregiving a balancing act. Extended family support has been vital alongside with my husband and older son's help. And with our lives turned upside down, we wait for a clearer path ahead. And a parent of a 5-year-old shared, "When my daughter was 5, I dropped her off at school and didn't even leave the parking lot before they called me back. She had passed out on the carpet and was too weak to sit up. That was 2 years ago. I took her to the doctor that day and learned it was long COVID. And now she is able to go to school most days. But when she catches an infection, it can take her up to 2 weeks to recover." I wanted to share these quotes that really reflect that long COVID is an experience that can happen across childhood and to really bring these experiences to the forefront as we're doing this research and really working towards care. So today we're going to talk about this agenda. We're going to start with what is long COVID in children and what has the research taught us. We're going to start with what is the Recover Pediatric study and what are its goals and what has it been doing. We're going to highlight some of the research that's been coming out from the Recover study, particularly focused on how does long COVID differ by child age. We're going to talk about the work about how do we move research out into the community quicker to healthcare teams and schools where it's really needed. And then what are we learning about, or what do we need to learn about the underlying mechanisms and what do we need to identify to develop treatments? And then focusing also on what can families do in partnership. So starting at that beginning here, what is long COVID? Well, when we're starting to do this researchers begin to collect information about symptoms that children are experiencing as the pandemic was unfolding. And families, doctors, scientists were all coming together to identify patterns that were emerging and being talked about. And as Megan mentioned, large scale programs like Recover were funded by the NIH to really include children and study them over time, to really launch this discovery phase that would help guide all of the research questions that we need answered. And so what we learned very quickly in the pandemic, and also from other infection associated conditions that existed prior to the pandemic, was that long COVID is what we call a heterogeneous condition, meaning that different people experience different symptoms. And this really led to challenges in coming together to create a precise definition. In addition, this was complicated by the fact that there were many different names being used for the condition early on. For example, the NIH was commonly using post-acute sequelae of SARS-CoV-2 infection. The CDC was commonly using post-COVID-19 conditions. The World Health Organization was using post-acute COVID-19. And other studies and communities were using other terms like long COVID, long hauler, or long-term COVID. And I highlight this because having these different names created challenges for conducting research and also created confusion amongst the community. But as these organizations came together, they started to put together definitions that were becoming more universal and defining that long COVID was generally and broadly symptoms, signs, and conditions that develop, persist, or relapse over time after a SARS-CoV-2 infection or the virus that causes COVID-19. And that these symptoms can last months or even years after the acute infection resolves and can have debilitating effects, severely impacting one's quality of life. And in 2024, the National Academy of Sciences, Engineering, and Medicine established a definition to really bring all of the evidence together so we were all coming from the same framework and helping to support changes related to services that families or people could qualify for. And this was a very broad definition that was designed to be very inclusive. And this is a summary of what that definition includes. And it highlights that long COVID, which was the name that came to consensus to be using, is an infection-associated chronic condition that occurs after SARS-CoV-2 infection and is present for at least 3 months as a continuous, relapsing, and remitting or progressive disease state that affects one or more organ system. And this included and highlighted 5 very important aspects related to long COVID. One was that laboratory confirmation or proof of the SARS-CoV-2 infection was not required, and that long COVID could happen regardless of what the initial infection was like. So whether it was mild or severe or really not associated with any symptoms at all, one could still get long COVID. It also highlighted, the duration of being at least 3 months, but for those less than 3 months to continue to monitor. It highlighted that more than 200 different symptoms and many conditions could be included in this definition. And highlighted that both children and adults and all people could develop long COVID, and that there was significant functional impairment associated with this, making it difficult to work or attend school, take care of family, and do daily activities. But I also wanted to highlight, as the research was unfolding, most of what we know about long COVID is from studies of adults. And when it comes to long COVID in children, there really were more questions than answers. And these gaps in our knowledge really stem from several common misperceptions, specifically the misperception that children didn't get long COVID. And then, if they did, their symptoms must be the same as those of adults. And also that if they got long COVID, they must get better quickly. And we know now that these statements are just not true and have led to a significant underrecognition of the public health crisis facing our children today. This uncertainty also builds on the fact that there are unique challenges to doing research to understand long COVID in children. Some of these include that it can be difficult to assess symptoms in children, especially younger children, because we know that symptoms may vary based on a child's developmental stage. We also know, especially if there's limited verbal communication, that it really requires caregivers or family to observe, identify, and interpret the symptoms that they're seeing. We also know there, especially early on, there were limitations in the research being done with children, that the study designs really lacked comparison groups. And so they were really unable to determine what was the effect of the COVID virus itself versus what might be the effect of the environmental changes that we broadly were seeing as a result of the pandemic broadly. They also had trouble with these definitions, as I mentioned. They had small sample sizes, which required them to combine all children into a single group, regardless of their age, and really had limited follow-up. And so, despite these challenges, though, over the last several years, the research focused on children grew substantially, and the Recover study, contributed to that. And so, what have we been able to document since the beginning? This is very important because we were able to document that long COVID is a significant pediatric public health problem, with research showing that nearly 6 million children in the United States are living with long COVID. And this could be up to 1 in 5 children who could develop long COVID after their COVID infection. Yet, despite this evidence, most children with long COVID have trouble receiving a diagnosis, have limited treatment or ability to get coordinated care. But what we were also learning is that similar to adults, long COVID is a heterogeneous collection of symptoms in children as well, with different symptoms presenting in different children, and that these symptoms occur in almost every organ system. And research was really being done to understand what's beginning to cause the long COVID. And multiple different mechanisms are being proposed and studied. These would include viral persistence, where a virus might be living in certain parts of the body, increased inflammation, potentially reactivation of other existing viruses, changes that happen in the gut, or the bacteria that live in the gut, issues related to clotting, or issues related to different immune responses. And so these potential mechanisms are very important to explore, but we don't know yet. We don't have enough research exploring these mechanisms to know if they might be different in children. That remains unclear. And I wanted to highlight the growing awareness that was happening about how urgent research was for children. And in February of 2022, Nature published an editorial highlighting that research was urgently needed for study of long COVID in children. And while that was late, it was 2 years into the pandemic, research in children had already begun, but it really highlighted the need for this, that like adults, children can experience long COVID, but few studies included young people, and that had to change. So, what is the Recover Pediatric study, and how was it designed to fill these research gaps? So, Recover stands for Researching COVID to Enhance Recovery, and it is a large research project aiming to understand the long-term health effects of COVID, with the ultimate goal of being able to better prevent and treat long COVID in the future. And Recover was an observational study, meaning that researchers were collecting information from participants and not starting with giving them new treatments so that we can really learn what is needed for the future. And so Recover is a national project. Up to 40,000 people of all ages, races, and ethnicity across almost every state were enrolled. And it was truly a collaborative effort from the start. And so this really started and focused around families, patients, and caregivers, really in partnership with researchers, clinicians, those from the private sector or federal partners, as well as community partners, all coming together to develop the important questions and aims of the study. And together, we designed the specific pediatric questions that were needed. These included how many children are getting long COVID, why do some children get long COVID and others do not, what symptoms do children feel when they get long COVID, how long do they feel sick, what causes it to happen, and what does having long COVID, how does it affect later physical health, mental health, and development in children? And so to answer these questions, Recover Pediatrics brought together four different cohort types or groups of children with more than 103 sites around the United States, all together to form what we call a meta cohort or a big study. And this included a first group, which we call the main cohort, which brings together children of all ages, from birth, infants, all the way to young adulthood, that were newly recruited into the study from healthcare or from the community. It also included bringing together groups of children that were already in other studies that wanted to participate and recover. This includes the Adolescent Brain and Cognitive Development Study of teenagers, as well as studies of infants born to mothers who were exposed to a COVID infection during their pregnancy. And in addition, a group of children who experienced MIS-C. So all of these groups of children come together to form Recover Pediatrics. And to date, we have over 22,000 participants contributing data to our pediatric study. And this is a large, diverse cohort that includes all of the people that you see here on this slide. So what are they doing in Recover? Well, in this group of children enrolled in our study, it includes those that had a history of a COVID infection and also includes that very important comparator group of children who were enrolled who were never infected with a COVID infection. So we could start to study what was directly related to the infection. And we needed to start characterizing long COVID based on the symptoms and conditions experienced and look at them by age. And then to take that information and integrate it with a wide variety of other kinds of data being collected over time so that we can understand, are there different types of long COVID that children are experiencing? What are the causes? What are the underlying mechanisms? What's contributing to why it's happening, and what information can we use to develop treatment, and how can we refine these as we learn more over time? And so when we started with characterizing what the symptoms are, we were looking for consistent patterns across these very large numbers of children and distinguishing what we were seeing from other conditions. And this work is critically important because it really serves as the foundation for what's needed for understanding how symptoms change over time, how they get better, how they stay the same, understanding the underlying causes in order to develop screening tools that can be used in practice and can be used to develop prevention strategies as well as treatment. And so I wanted to talk about what we've learned so far in our recent publications, and particularly how does long COVID differ by child age? And so this came from our initial studies where we were comparing symptoms experienced by children who had a history of a SARS-CoV-2 infection that we sometimes refer to as infected, and those without a history of a SARS-CoV-2 infection and that we call uninfected. And this group also had no antibodies against COVID. And so we did our best to show that they were truly uninfected. And then we looked to characterize what are the different symptoms that children were experiencing to help us identify those with long COVID. And how did this differ by age? And we published our first big paper looking at this in JAMA to characterize long COVID in school-age children and adolescents. And what we really found was that symptom patterns were similar across these ages and similar to those found in adults, but there were distinguishable differences. And so this really highlights what some of the common prolonged symptoms that we were seeing in these different ages. And that while there were symptoms that were common across these ages that you can see in the middle that affect almost every organ system of the body, we were starting to see some symptoms that were more common and unique to school-age children, and some that were more common and unique to teenagers. And we use different statistical approaches to develop what we call a research index to help researchers to identify children with long COVID in these different ages and which symptoms are the best at helping us identify someone with long COVID compared to someone who was never infected. And we learned that 10 symptoms in the school-age children and 8 symptoms in the adolescents came together that we could calculate whether they were present or not to help us identify children that had long COVID and to develop thresholds for who those children might be. And you can see the different kind of symptoms that are being expressed in the different age children. And what we were able to build on this work to do is to identify, are we seeing different types or clusters of different symptoms in long COVID in different ages? And we really were. And what we see in the middle here is that there were 2 different types of long COVID that we were seeing in both the school-age children and the adolescents that were similar to those in adults. And those included children that were experiencing many different symptoms across many different body systems. We were also seeing children where they were predominantly experiencing symptoms of pain and fatigue or low energy. And then we were seeing some unique types of long COVID specific to school-age children. One where children were predominantly experiencing trouble with sleep, trouble with their memory and focusing, and another group where their primary symptoms were stomach pain, nausea, and vomiting. In addition, in the teenagers, we were seeing a unique group where their primary symptom was related to change in their smell and taste. But then we wanted to know, what about our youngest children between, birth and 5 years old? And so we recently, in the last month, published a paper in JAMA Pediatrics characterizing long COVID in early childhood. And what we found were that the signs and symptoms of long COVID are really variable across different ages, particularly in this youngest group. And that the most common prolonged symptoms in infants and toddlers look very different than they do in older children. That they include trouble sleeping, fussiness, poor appetite, stuffy nose, and dry and wet cough. And the most common prolonged symptoms in preschool age children included dry cough and daytime tiredness, sleepiness, and low energy. And what we were able to do is do a similar process to develop a research index that would help us identify children with long COVID in these young age groups as well. And I wanted to highlight that these indexes are used and developed to help us identify children in research studies. And they're not a clinical tool at this time for diagnosing long COVID. But they really help us to learn more about what long COVID looks like in these different ages and serve as a first step in this direction. And so these indices serve as a framework for research studies. They can be used to follow children over time, to study their underlying mechanisms and how COVID symptoms are progressing over time, whether they're persisting, improving, relapsing. But I wanted to highlight that they're not intended for clinical practice at this time, and even one symptom may be sufficient to indicate long COVID in any given child. And that these indices in no way are intended to minimize the importance of the many other symptoms that children may be experiencing. But they serve as a first step towards developing future tools that can be used to identify children with long COVID in the community. What are the implications of these findings? Well, we know that even though these indices may include only a few symptoms, they actually really help to pick up children that experience many other symptoms that aren't part of the index. We do see that, and that has been included in the research. And these findings really help clinicians, healthcare teams, and families by raising that awareness that people mentioned as a barrier, by showing that children of all ages can develop long COVID and that their symptoms are variable across these ages. And that it highlights that it's critically important to understand why these age differences are occurring and that we are likely to need variations in our screening tools and our treatments that are age specific. And so that was really important for us to know as a scientific community. But this brings us to our question about, how do we take the research that we're learning to help families now? How do we spread this research as quickly as we can to healthcare teams and schools? And this is not an easy thing to do, and historically has been a slow process for all medical conditions over time. But in long COVID, we're trying to do this as quickly as possible, and this is where more effort is needed. And I wanted to just highlight some examples. Long COVID families in particular is doing an amazing job at helping to get the research that Recover is doing out to the public as quickly as possible. And we've partnered on developing these plain language pictures of the results to help to do that. And I highlight this picture here because even just a month after the early childhood paper coming out, these results are up on the website to be shared in a plain language way. So we can spread the information as quickly as possible. I also wanted to highlight that along with the papers, JAMA Pediatrics published a JAMA Pediatric patient page, which goes along and summarizes what long COVID looks like in children and how these symptoms differ by age. And this is a free document that JAMA Pediatrics puts out that can be shared widely with families and healthcare teams and schools. And we've even heard from families that participate that some have printed this, that they have brought it to the doctor with them. And that has really helped in the communication with their pediatricians to get some of the awareness and support that they need. Also, in this partnership, we've worked with families to develop what we call a long COVID tip sheet, which also can be shared to help to know what is needed when you want to talk to your doctor about long COVID. It helps to provide some of that information. So what do you want to share with your doctor? What do you want to prepare to bring with you before you go to an appointment? What might you want to talk about during the appointment in a way that might make it easier to communicate your needs to the doctor? And what might you want to think about after that is done? So these are the beginning of some tools and resources, but we do know that many more are needed. And so this is a really big next step of the needing to educate the healthcare system, all clinicians, and building the needed systems. And we know that the research is the foundation for this. And what's critically important is that we want to work on, once research findings are available, as I mentioned, getting them out to the healthcare and school systems as rapidly as we can. And this is going to require, recognition, training, and helping of clinicians to understand and recognize this. And bringing together medical societies, academic centers, other communities to help to create education courses and fundamentally clinical guidelines that are needed and toolkits to support those on the front line and working over time to spread this education so that we can, as more research comes out, bring it closer to clinical care. But we know that more work is needed and that more research is needed to be able to bring what's needed to the community. And so some of the next steps is that we need more research to learn about the underlying mechanisms in children and to identify targets for treatment. And this is research that is ongoing. And so what this brings us back is to, once we've characterized the symptoms, the work that's happening now in Recover and also in many other studies is trying to further characterize the different types of long COVID, bringing together other types of data to get a fuller understanding and to identify these mechanisms, causes, and targets for treatment. And so in our pediatric study, what's happening now is that we are following up to 4,000 children that are part of Recover for many years, for up to 4 years. And this is, part one, we did our initial assessments, and part two, we're following these children for 4 years and seeing them in person at 6 months, 12 months, 24 months, 36 months, and 48 months after they enroll in the study for these in-person assessments. And we're also conducting a part three of our study, which is ongoing now, which involves more intensive studies for those of our participants that are most severely affected. So we can really get a deep understanding of what's happening to help lay the foundation for treatment. And so we have generated a tremendous amount of data for children of all ages. And this slide really just gives you a highlight of some of what that data is. We have over 20,000 symptom surveys collected. We have over 5,000 office visits that are being done. We have, over 3,500 intensive neurocognitive testing to look at development. We have over 45,000 laboratory tests that we're looking at, and over 20,000 blood samples that have been stored and are being available to all researchers to answer additional questions. And this is laying the foundation for so many of the research studies being done now. And these are just some examples. So what can we learn about the worsening of existing conditions in children and how they are affecting long COVID and need to be managed over time? How can we learn about the symptoms that began and how they change over time? And what can we also learn about new conditions that are developing as part of long COVID? And when we highlight what are the most critical questions that people who are suffering are asking, how does it happen? Who is going to get it? And how can we get better? It brings us to the studies that we're doing related to pathobiology, these mechanisms, predictions, and treatments. And Recover Pediatrics is really designed to help answer all those levels and lay the foundation. And I wanted to end with highlighting a part of Recover that really brings us even closer to supporting work related to treatments, in that there is a project that we're doing that's called the Systems Biology Project that really lays a holistic view of creating biologic data for the whole child. And often in science, there are many individual smaller studies that are done by different investigators, and this can have limited power to answer big questions with smaller numbers. It can be difficult to share the data. But by having one big, large study like Recover that brings together data of all kind and makes it publicly available for all researchers to use, it enables us to be able to use the data very efficiently. And this is really important because we know long COVID is very complex and that there are different types and there's likely different mechanisms and we may need different treatments. And so this interconnected way of studying all aspects of the body and bringing all this data together and making it available helps us to capture this complexity and to share this type of data. And I wanted to highlight that we are doing this across all ages, children and adults. And we're able to look also at the biologic factors that are needed to develop maybe a biomarker or a way biologically of knowing what's happening. And so we've collected billions of different measures related to genetics, people's genes, how those genes are being used, how those genes are turned on and off, how those genes might create different proteins that are needed or different things related to the metabolism. And we're able to study that over time in order to begin to answer those questions about what is happening specifically in the body that might be causing this. Are there ways that we might be able to see how different types of long COVID are related to these changes? Maybe this can help us to better diagnose and specifically develop treatments. And for example, what we learn from these biological studies may be related to the different types of long COVID we're seeing. And that can help to develop the different treatments that different types might need, and then to study them in clinical trials. And so it lays the foundation for all of this work. And so we know that clinical trials are desperately needed for children, and they're needed to test treatments and to develop management strategies. And that what we learn from adults is helpful, but that studies need to specifically be done in children so that we can have treatments that clinicians feel comfortable using and that we know are safe and effective for children. And so Recover has been doing clinical trials in adults, and they have launched a new network called Recover Treating Long COVID, or TLC. Many of you may have seen this. And while there are currently no approved treatments for children with long COVID and really no clinical trials, there's active work. And this has really engaged the community, and I thank all of you, because the NIH put out a large call for the community to share what medications and treatments have been working for them or that they suggest to be used. And you can see that all of the agents that were submitted, 72% of them were submitted by families. And this is laying the foundation for clinical trials, specifically in children that are, will be working on and coming shortly. And so I want to end with how critically important family voices are through this entire process. And they really have driven the progress that we've seen so far and will continue to help us drive the progress that we need. And so families, reported the symptoms that they were feeling, and that guided early research and helped to define the condition. They participated in these studies, which I know is not easy to do, which is essential for understanding the science and moving us closer they've advocated for research, for clinical trials specifically for children and for education of the healthcare system. They've educated clinicians themselves and they have connected with each other through organizations like Long COVID Family and are really needed in every step going forward. And so I wanted to acknowledge that studies like Recover are truly a collaborative effort as well, and to thank all of the families and participants that take part in these studies, all of the staff, the representatives, the NIH, and all of the institutions. And to really thank Megan and Long COVID Families for really launching our second annual Pediatric Long COVID Awareness Week. This is so important that we raise this awareness, and I wanted to thank Megan and all of you. And so I will stop there. Thank you.
Thank you so much for that, Rachel. Really appreciate it. Before we go to Q&A, I did want to do one more poll. The question is already in the chat if you all want to go check it out and give us your answers. The question is, if you have a child with long COVID, do you feel like you currently have access to a pediatric provider who understands long COVID? Yeah, okay. And I think part of what we were showing there is where we are in the process is we're not at the point where we have clinical guidelines, but what we do have is the patient page, which is in the chat. As Rachel had mentioned, families have printed that out to bring it with them to the pediatrician. And then there's some guidance in the how to talk to your doctor. That is also helpful. And then always you can refer them to the Long COVID Families website because as Rachel mentioned, we on the last paper that was updated within 2 days of the paper being published. We're trying very hard to get that out as quickly as possible to really try and help families because we're, given that I work with long COVID families, I'm very well aware that we're lacking provider knowledge on long COVID in kids. Yeah. All right, guys, I'm going to switch to the Q&A. And let's see, we have a couple questions in here. It's still time to add questions if you would like. Let's start with the first one. It's many pediatricians are unsure of how to recognize or diagnose long COVID in children, especially when symptoms don't fit familiar patterns. I wonder if that means adult patterns. What guidance or diagnostic tools are available and how can we support families seeking answers? I think that we're going to say that means they're expecting long COVID to look like it looks like in adults.
Yeah. I think that is one of the biggest challenges that we hear from families is that there isn't enough awareness that of the findings that I described today, that long COVID doesn't necessarily look the same in different age children. And it looks different in infants and preschool age children and even school age children and teenagers. And while there are these similarities across all of the ages, there can be distinct differences, and that can be challenging. We put together the long COVID patient page to help in a very concise way start to show that these look different from each other. Unfortunately, we don't have comprehensive diagnostic tools yet or screening guidelines for pediatricians. I hope that this research will be the foundation to build that over time. But raising the awareness and talking and documenting the symptoms that your children are feeling so that when you go to the doctor, you can have that and put it in context with the research that we are learning.
Yeah. So the research we have now will hopefully lay the foundation, as you said, for clinical guidelines. Can you kind of explain what clinical guidelines are? Because I don't know that everybody understands what that is.
So clinical guidelines are often different for different conditions, but they get put out many times from specialized organizations that support the different medical communities. And so for pediatrics, it might be from a specific pediatric national organization. Sometimes if it's a specific condition, it might be an organization that supports that condition. For example, like for asthma guidelines, it might come from an organization that studies respiratory illnesses specifically. And what those guidelines do is they often bring together panels of experts that review the existing evidence and very comprehensively and come together to put together a concise step-by-step kind of plan for how you might come together to make a diagnosis. And then based on different symptoms or different parts of that diagnosis, it might make recommendations for next steps. And so we don't have that yet. They're starting to be developed for adults, and those can serve as a model for pediatrics. And as more of the research that I described comes out, it will lay the foundation for being able to bring together those experts to create those recommendations. And then those get disseminated through these national organizations or other mechanisms, either through journals or other ways, and they begin to be used and to support the care that pediatricians or others give.
Okay, thank you. Let's see. The next question is, what can we do to actually speed this up? Families are desperate for care. How do we turn this all research into action sooner, if possible?
Yeah. That is such an important question. And I think the advocacy work that we're all doing is so critically important so that we can move all of the areas together simultaneously. We want to have more research focused on children so we can begin to answer all of these needed next step questions. But at the same time, we don't want to wait till the end of that to get the information out to healthcare, to schools. We want to be able to have mechanisms for getting that information out as soon as it comes out in the literature. So there isn't that delay because often there is a delay in the science. This is not just for long COVID. This is a long history of all science that it takes, sometimes many years for information that's been published to make it into practice. And so putting in systems that move that piece quicker
Yeah.
and not just healthcare systems, but also schools.
One of the pillars of Long COVID Family's mission is to accelerate research. And what we mean by that is we work to get investment in the actual research, and then we work to disseminate it and spread it as quickly as possible. And I'll share, we have a mom who was working with us who actually just reached out to her public health department locally, was able to schedule an appointment with them. And we were the first ones to share all the research on children with them. And that happened recently, and they're actually very thankful to get it all and to talk to the families directly and to understand it. And then asked us to stay in touch with them. But that was one way that we got information into policymakers' hands very quickly. And that was just literally a mom who sent an email. So part of this is that, I know families are very anxious to get the information out there. When we work together to do that, it does help expedite it and speed it up. This week is Awareness Week, and we've been sharing family stories. And I do want to affirm for everybody who's sharing their story that it matters, that we're getting feedback from doctors, from policymakers, that they didn't fully understand that it looked a certain way in children or that children were experiencing it a certain way. It was eye-opening, we were told by some people who were seeing what's coming through our social media. So that is a way as well to help participate in the process and kind of speed it up. So let me see. But this is an interesting question. Does it matter how old a child is when they develop long COVID? Are there differences in symptoms and recovery depending on age?
Yeah, that is a very important question and one that we're working on now. So what I described to you today was that we do see different symptoms experienced by different age children, that there is variability. What we don't know yet, and what we need to learn from following these children for over time, is what does it mean for the progression of long COVID, depending on how old you were when you first got it. And so, what we need to know is if you got long COVID as a baby, what does it look like for you when you're now in preschool? When you're in school age and you had long COVID and we follow you over time, what does it look like now that you're a teenager? And so those are the studies that the questions that Recover will be working on over time so we can understand that better.
Okay, so we have a question that says, can you address the impacts of vaccination and the review of the difference in outcomes? So there's two parts. We'll start there. So I assume on long COVID. So can you address the impacts of vaccination on long COVID?
Yeah, so the Recover study that I described today has collected a lot of information about vaccination, and we will be looking at how vaccines relate to the symptoms described. But another part of Recover that uses data from lots of medical records, millions of children around the country, they have published that having had a COVID vaccine is protective against developing the symptoms of long COVID. And so a lot of the research that is out there is showing that protective effect.
And then there's a second part of the question, which I can answer. It says, any kids with long vax? So I was anticipating we might get this question. So I did actually reach out to a couple people that are studying vaccine injury yesterday. And so I can't speak to that exactly, but because I wanted to clarify, because some people are calling it long vax and it sounds like long COVID. So like one of the clarifications is that they're using the term post-vax syndrome, so PVS, and they've explained that they can distinguish it from long COVID that has a different immune signature on that. So I just wanted to clarify that because we're talking about long COVID, so that's a different thing. So
I also
can't
wanted to
really.
highlight that our study that we talked about in early childhood, between birth and 5 years old, so many of those children were too young to even get a vaccine. So, that study really shows that many of the children that never had an opportunity to get vaccine were developing long COVID.
Yeah. A good person to follow for that is out of Yale. Awasaki is the one looking into the post-vax research. There's another question here about, has there been any employment of AI for the data gathered?
As it's a good question for our statisticians. Most of the work we've done so far doesn't involve AI. There are large teams of scientists and biostatisticians that are working incredibly hard on the data analysis. But all of the data, all the different kinds of data that I described to you are put together in a consolidated database. They are all maintained on an publicly available NIH funded data system and can be accessible by researchers both within Recover and outside of Recover. And so it will be an incredible resource for all different kinds of research going forward.
Can you elaborate on that? And I just want to really emphasize, so the data is available to other researchers as well, because I don't know that that's well known.
Yeah, the data is available to other researchers as well on the recovercovid.org website. There are instructions on how you might get access to that data. You have to apply, and it's a little bit of a process of explaining who you are, which is important, but that it is accessible to researchers outside of Recover as well as within Recover.
Great. And then it says, how long would you guess until pediatricians are trained to diagnose long COVID?
I think that training will happen over the next, several years, and it will happen. It's already happening in small ways. And I think the more the research comes, the more it will grow exponentially. But I don't have an exact prediction of the time period, but I think we will see it growing more and more as the studies start to come out more and more, specifically focused on children. We've already seen the growth just from the first two big papers that I highlighted today.
Yeah. What were you, the patient page, how many times has that been downloaded?
That patient page has been viewed over 30,000 times so far, and it's only been out for a little over a month. Um, so it is getting a lot of attention, and I think that that will continue to raise awareness.
Okay, I think we answered almost like there's a couple repeat questions in here, but I think we answered, unless anybody has a last minute question they want to add, most of the questions. So I really appreciate it. Thank you for your time and thank you for, sharing your perspective and walking us all through that. Children living with long COVID absolutely deserve healthcare and public health system that's ready to recognize what they're experiencing and respond with real support. And thank you. Your engagement today shows that, we've got people working on it. So really appreciate it. And then for those of you that are listening, there are ways that you can get involved and help because part of what moves us along is that the community is working to spread the word. So you can subscribe to our newsletter, stay involved with us, share our resources, the website that we have an entire page dedicated to pediatric long COVID that's updated regularly. We are going to be bringing on in the fall some more resources that will be shared. We'll be using our blog to start disseminating some of the research that should be coming out shortly and explaining it to families. But just follow us on social media. We put out the research in that way. And then we are, if you become part of our community, we have people within our community that are advocating and working together to do so. We are launching a discussion forum here this fall. That's a private discussion forum off social media that will have a separate app we can get access to where families can meet and connect and even support each other in sharing the information, sharing the resources. As I said before, we have a mom who shared with the public health department. We've had families take information to the major hospital in their area and ask if they could share it there. And that has had immediate effects on their community locally and how well the doctors in their local area know about pediatric long COVID. We've had families do interviews with the local news. We've had families make appointments and do, with the school district to share information with the school districts. And so these are ways that we can expedite it as a community. And if you're interested in that, just, join long COVID families in that. That's what we're trying to do right now. But so I really appreciate, we'll end it there. And I really appreciate everybody's time. We'll send out an email with the additional resources. And of course, if anybody thinks of a question later on, feel free to email me. All right. Thank you for everybody's time. I really appreciate it. Thank you, Rachel. And have a good day, everyone. Bye-bye.